Channel 9 News reporter Dave here, reporting on the illicit drug MDMA. Lately, there have been some horrible deaths in the news because of drugs. MDMA is a drug that can cause such things. The real name for MDMA is methylene dioxide methamphetamine. Moving on to a few street names for MDMA that you youngsters should be careful and watchful for. The names Molly, XTC, Scooby Snacks, Hug Drug, and Beans are the main street names for MDMA. Moving to the description of MDMA. It is a synthetic psychotic drug chemically similar to the stimulant methamphetamine and the hallucinogen mescaline. MDMA is considered a drug of choice within the rave culture. It is a slight stimulant that increases the amount of serotonin active in the brain and is normally swallowed or snorted, and typically dosed of around 100 to 125 grams. The classification of MDMA. MDMA is a Schedule I drug, which has the following characteristics. The drug has the potential for abuse, it has no current medical treatment in the US, and there is a lack of safety for the use. Since MDMA falls within these three main bullet points, it is considered a Schedule I drug. How is it administered? MDMA is most often in tablet form and is usually ingested orally, but it's also available to be snorted and occasionally smoked, but very, very rarely injected. MDMA short-term effects. A few main short-term effects are confusion, depression, sleep problems, severe anxiety. As you can see, this picture to the left of me, my colleague Nicole found, is an image of a man who is suffering confusion because of the usage of MDMA. Okay, moving on to some long-term effects. MDMA increases heart rate, and it can lead to liver and kidney failure. And finally, it's extremely toxic to the brain. Finally, a few stats on MDMA. 82% of Australians during 2000 and 2005 died because of overdose on MDMA. 65% of Australians found the drug useful in stimulating their senses. Finally, now back onto you, Nicole. Oh, and kids, don't do drugs. Thanks, Channel 9 reporter Davey Boy. Good night.